Statistics from the World Health Organization show that 800,000 people die from suicide each year, which results in the second leading cause of death in the world's population between the ages of 15 and 29 years old. The World Health Organization puts the South African suicide rate at the 23rd highest out of 107 countries measured. The prevalence of suicide among youth increases significantly throughout adolescence. Each suicide is the result of a complex, dynamic, and unique interplay between a number of contributing factors. Interdisciplinary approaches, multi-level strategies, and intersectoral collaboration are needed to prevent suicide, which could only be successful if there is a clear and effective national suicide prevention strategy. The Mind Matters school program within Cape Mental Health addresses an objective of the mental health plan adopted by the World Health Organization in providing comprehensive, integrated, and responsive mental health and social services in community-based settings. It is a program for senior secondary schools that aims to improve the mental health and well-being of young people. Currently, the program is offered at Ocean View Senior Secondary and Zikoflay Senior Secondary Schools. It could be considered as a framework in that it provides structure, guidance, and support, enabling schools to build their own mental health strategy to suit their unique circumstances. Mind Matters is based on the principle that the best mental health strategy is one that prevents issues from arising in the first place. For this reason, Mind Matters helps schools promote positive mental health through the whole school community and aims to prevent mental health difficulties in students by taking steps to improve relationships and resilience. According to the 2017-2018 Annual Judicial Inspectorate of Correctional Services report, suicide is the most common type of unnatural death in our correctional facilities. Suicide by hanging was reported to be the most common method. Inmates make use of an array of items, but mainly ligatures from bedding and clothing. Poor social and family support, prior suicidal behavior, and a history of a psychosocial disability and emotional problems are common among inmate suicides.
Okay, so in 2014, the Criminal Procedures Act of 1977, Section 77, was changed after there was a case that was cited. It was the Steelman case, where they were found that persons with mental disabilities should not be tried in the same way in a court case, in a criminal matter, as it was unconstitutional because prisons are not suitable environments for people with mental disabilities. It is considered as cruel and inhumane, and therefore Cape Mental Health moved that prison should be removed as an option for people with mental disabilities. Well, access to justice provides support to the person with mental disabilities who is in conflict with the law by providing them with a support at the time of arrest. The police may contact us, and so as soon as we hear that someone has been arrested, that we provide them, investigate whether the person has legal representation. Also, we advocate, of course, that the person should be released from a prison or from custody, and also ensure that the person has access to a mental health practitioner or service if necessary, and we ensure that they be provided with ongoing support throughout the court case.
A community-based rehabilitation centre plays a vital role in the lives of people with psychosocial disabilities. It creates opportunities for them to begin the journey of recovery, find meaning in their lives, and actively contribute to the social and economic well-being of each other and their families. The aim is to enable persons living with a psychosocial disability to ultimately become reintegrated into society and the workplace. Cape Mental Health's psychosocial rehabilitation services pays off abundantly by keeping people healthy and out of hospital. The new community-oriented primary care model undertaken by the Provincial Department of Health places the specialized community-based support group service at risk. This will be to the detriment of persons living with a psychosocial disability, as it provides a focused level of support in community integration. We call on government for the continuation of funding for these programs and plead for a greater investment in mental health.
Fountain House is a rehabilitation centre. We provide a day program for adults with a psychosocial disability. So people are referred here, they attend our day program for 5 days a week, and they are exposed to skills development, psychoeducation and vocational enrichment activities. Rainbow Foundation is based at Fountain House as well, but the team goes out and they run community-based support groups Mondays to Thursdays. And these groups are run at community venues or at libraries. So service users who are in that area can attend that support group if that is what they want. Remember, in PSR, it's all about choice. It's all about the journey of recovery for the person. So if they're only ready to attend a once-a-week support group, then Rainbow Foundation is where we would refer them to. I think PSR as a model is a model that changes people's lives. If we did not have community-based services, many people, and we are talking a few hundred people, many hundreds of people, who might not get the support that they need, might not be as well and this far along in their journey of recovery as they are. So certainly, with the changes in the funding structures in this province at present, PSR services are at risk. If there are no support groups, people's lives would be affected.
Despite mental illnesses and neurological conditions being the third highest burden of disease in South Africa, only 4% of the health budget is spent on providing mental health services. Very little of that translates to services within communities. Our mental health service users are extremely concerned about further cutbacks in funding for mental health care at community level, where people should be living in their homes and with their families, no longer in institutions, in their communities. We have sufficient research. We know the statistics. We know that every 40 seconds someone dies because of suicide. Yet, our investment remains sorely lacking. We are extremely concerned about this growing gap in mental health services. Instead of scaling up, we are scaling back. How do we justify the policies, the declarations signed, the intention that doesn't move beyond the actual investment in mental health? We believe that people with mental disability should be given the dignity, they deserve, the treatments and interventions that they deserve. We have the narratives, we've got the stories, we have the lived experiences of people telling us about their recovery journey, and that is only possible when we invest in lives. The call today is for greater collaboration, which includes the mental health service user, who has to be central in advocacy, but also central in service provision. Intersectoral collaboration is what is urgently required, but most of all, greater financial investment. Let's make mental health a priority it deserves. If we want to save lives, if we want to give people the dignity that they deserve, then it's time for us to act now. No more discussions. The deadline has arrived, and it's time to invest and turn back the clock to all the policies that we've discussed, all the time frames, and make those into real actions so that people with mental disability may live full and integrated lives as equal citizens in this country.